Yo creo que antes de empezar, quiero pedirle que en el futuro, antes de que nosotros lleguemos aquí a las pistas, que se comuniquen con oficinas como la mía para poder tener esta conversación, porque es difícil para mí poder abocar por diferentes querellas que tenemos en la comunidad si yo no sé que están impactados directamente. Yo sé que Frank se comunicó con una de mis empleadas, pero muchos de ustedes tienen mi número de teléfono directamente. Entonces, yo pienso de que esta legislación simplemente va a impactar a quién nosotros como negociantes podemos venderle cigarrillo, ¿no? Que la legislación va de 21, baja la edad a 18. Nosotros hemos oído de muchos niños en nuestra comunidad que dicen que la venta de cigarrillos está impactándolo negativamente. Hemos oído de diferentes universidades. Entonces, estoy un poco sorprendida, ¿verdad? Porque no vi un impacto negativo en querer bajar la edad de 21 a 18 y no vi, y también oí de muchos negociantes que hay un problema en la venta de cigarrillos porque muchas personas venden cigarrillos ilegales y que no siguen el proceso apropiado, ¿verdad? Esta ley simplemente nos va a alinear el Consejo Municipal con la ley que hay a nivel del Estado. Entonces, quiero oír de ustedes cómo es que ustedes se sienten que van a ser impactados por esta legislación y le pido que en el futuro se comuniquen con nosotros antes de pistas como esta, porque entonces podemos abocar diferente. Gracias.
So should we just wait till Vince is coming back to see if we can use their... this is just about the bill. It's not... What is it? This is just describing the bill.
Okay.
Should we do that in Spanish too?
Which one? Where's that page?
I think that page is... where is the chair? Before that. We might not have that. You only have what you're talking about. So this is just, he's going to give the bill number and...
¿Cuántos en el grupo necesitan traducción? ¿Todos?
What we're trying to see if we can get the box. We'll let their translator actually translate, and they can use the box to the system. That way it'll be faster than delaying the hearing.
Okay. Faster than her just translating as you speak.
Y también en el futuro, si vamos a tener un grupo así que no entienden inglés, podemos coordinar mejor antes de que empecemos la pista, organizar y coordinar una persona que pueda traducir.
Yeah? Yeah. And that's why you're here, to testify. That's the conversation. We got it. We received it. We have all your names for testifying. At no point was there any conversation about language needs, so that's why we didn't have them. But we received your email. We have all the 10 testifiers' names, absolutely. We are very cognizant that you had reached out, and we are happy to have you here.
Thank you. We're going to find out who you sent it to.
Do you have something? Where's Vince? Let me call Vince and see. That's all we want. We have
Frank, you guys said you have someone that can translate here? Okay.
Hold on. As per instructions we just received, we can proceed with our hearing, and when somebody wants to testify in Spanish, we can have that. By that time, we'll have the box here to be able for us to understand. Yeah, that's what I'm saying. They have a translator.
Over here, so they're translating.
Vince, we have a translator. We can get started then. Okay, all right. Sorry for the delay, but let me have the translator who's here. Please sit with the people who are testifying and to, excuse me, translate as they go as needed and vice versa when it's in Spanish. So we are proceeding with the hearing. The clerk will please read the title of the first bill.
Bill number 250213, amending section 9-633 of the Philadelphia Code entitled Sale of Electronic Smoking Devices and Unapproved Nicotine Delivery Products to update definitions and to provide for additional penalties, enforcement, and compliance options, all under certain terms and conditions.
The clerk will please call the first witness to testify on this bill.
Hello?
Yeah.
We are calling the first witness to testify to the court.
Ben Hartung, Public Policy Advisor of the Philadelphia Department of Public Health.
¿Usted va a testificar en español o en inglés?
I will interpret in Spanish, but remember, you're working with an interpreter. I will do consecutive interpretation, but you have to help me out, please. So slow down your piece.
Please state your name for the record and proceed with your testimony.
Good morning. My name is Ben Hartung. I'm a public policy advisor with the Department of Public Health. Good morning, Chair Ahmed, Vice Chair Lozada, and members of the Committee on Public Health and Human Services.
We'll take a pause and let her just introduce you.
Sorry.
Good morning, I'm Ben Harford, and I'm here in a public health department.
Why are
for
you?
Public advisor.
We just need you to speak in Spanish, not English.
Sorry about that.
There we go. Yeah, go ahead. Is there not a button?
And this is improvised, so. My apologies, the interpreter wasn't ready for this kind of interpretation. I just was here present to help my colleagues from the Bodegas Association. So this is be a little bit rough for me because sometimes, when you are interpreting like this, you get prepared ahead of time with the material. And this is like an improvisation for me.
I
So
appreciate, we
I will do my
appreciate your
best.
support, yes.
I'll do my best.
This is for your community.
Yes.
Yeah.
So I'll do my best so I can
Yeah.
do it. So you can read from there, then you hand it to me.
So if you can,
First paragraph.
yeah.
Okay. Should I start over, you're saying? or-
No, you
Okay.
start where you stop.
So, sorry, on behalf of Commissioner Pollock Raval Nelson and the Health Department, thank you for the opportunity to testify today regarding Bill Number 250213.
Estamos aquí representando al comisionado y gracias por la oportunidad de representarlos a ustedes aquí.
This bill proposes amendments to the Philadelphia Code Section 9-633 entitled Sale of Electronic Smoking Devices and Unapproved Nicotine Delivery Products.
Esta presentación hoy es para hablar sobre el código de la sección 9-633 sobre vender aparatos electrónicos inapropiados con nicotina.
The Health Department agrees with the bill's goals of reducing youth access to vaping products.
El Departamento de Salud está de acuerdo en que se limite la venta de productos electrónicos con nicotina a la población joven.
However, we have some concerns regarding whether the language of the bill as written will assist us with getting to that goal.
Pero tenemos una preocupación de que el lenguaje con que se propuso esta legislación va a ser una barrera para alcanzar esta meta.
The department is reviewing the amended language and will need guidance from the law department.
El departamento está revisando el lenguaje que se usó y necesitaremos la cooperación del departamento.
We welcome continued dialogue on Bill Number 250213 to ensure that the goal of the bill will be achieved.
El departamento va a seguir revisando las metas de la legislación número 25021-3 para asegurarnos que la meta de esta legislación sea alcanzada.
We respectfully request that the bill is held in committee to allow this continued engagement. Thank you for the opportunity to testify today.
Vamos a asegurarlo que nos vamos a encargar de que esta legislación sea pasada adecuadamente. Muchas gracias por la oportunidad.
Thank you for your testimony. I'll start with the first question.
Gracias por el testimonio. Vamos a iniciar con la primera pregunta.
Could you provide the current number of licensed tobacco retailers operating in Philadelphia as of 2025?
¿Usted puede proveer el número de licencias que están actualmente aprobadas para usarse en la ciudad de Filadelfia?
I can follow up with that exact number to you very shortly.
Le puedo dar
Okay.
esa información cortamente.
Do you have the estimated number of unlicensed tobacco retailers currently operating in the city?
¿Usted tiene ahora mismo el número actual de los negocios que están vendiendo cigarrillos sin permiso?
That might be a harder number to find, but I can follow up with the information. that
Need an
we-
approximation.
Ese sería un número difícil de alcanzar, pero puedo proveerle un aproximado. Sería una información necesaria para obtenerle.
Given that 149 retailers had their permits revoked in 2020 for non-compliance with age restrictions, representing roughly 6% of total retailers at that time,
En el
What?
2020, 149 tiendas se les removió el permiso de vender tabaco, calificando eso un 6% de la población.
what percentage of retailers have violated age restrictions as of 2025?
¿Qué por ciento de vendedores o de negocios están vendiendo cigarrillos inautorizados sin permiso?
And sorry, just to make sure, what percentage are
Of-
current retailers have violations under the youth sale law?
Correct.
I
Le
will
pido
follow
por
up with
favor
that.
la información de cuántos vendedores ahora mismo están violando las ventas.
In 2020, Pennsylvania reached a $38.8 million settlement with Juul Labs. How much of this was allocated to Philadelphia, and what programs or initiatives within the city have been funded by these monies? Oh,
There were-
I'll
could you
repeat it
repeat the
again.
question? Yeah, I apologize.
In 2020, Pennsylvania reached a $38.8 million settlement with Juul Labs. How much of this was allocated to Philadelphia, and what programs or initiatives within the city have been funded by these monies?
And I apologize, the same
En el
response will be
2000,
that.
en el 2020, el estado de Pensilvania ocupó 38.8 millones de dólares en educación y programas. ¿Qué por ciento de eso fue ocupado en la ciudad de Filadelfia?
So that money passed through the State Department of Health, so I'd have to get back to you on the specific
So
number.
did we get something here?
Entonces, ese dinero fue pasado al Departamento de Salud de la ciudad de Filadelfia. Yo tendría que buscar una información con ellos.
I have to follow up to the specifics on that.
Tengo que
Okay.
seguir eso específicamente.
These are just getting on the record, the questions.
Entonces, eso es para las actas. Esas preguntas van a estar están asentadas en las actas.
How much revenue has the department collected from fines imposed on retailers for violations related to youth sales, and where are these funds currently allocated?
Entonces, ¿cuánto dinero fue recoleccionado en las multas que se le hizo a los negociantes en dinero? ¿Y dónde fue utilizado ese dinero?
Thank you for that question, and I'll follow up with you as well.
Gracias por la pregunta. Le voy a dar seguimiento a usted con eso.
Considering the current landscape of tobacco sales and youth access in Philadelphia, what specific amendments or additional measures would you recommend to strengthen the bill?
Entonces,
250213.
debido a la gran población de juventud que está usando los cigarrillos, ¿qué por ciento o qué recomendaciones usted recomienda para que esta legislación pase? La legislación número 250213.
So I've been unable to have a specific conversation since we received the amendments with Commissioner Raval Nelson and Don Kieswetter, who's the Director of Environmental Health Services, but we will be doing that very shortly. And like I said in my testimony, we'd love to continue this conversation with you in the committee.
Entonces, actualmente no tengo ninguna información sobre eso. Recibí la notificación de la acomodación de esta ley. El tiempo de aviso fue muy corto, pero voy a dar seguimiento con su pregunta.
Does any of my colleagues have any questions of this?
¿Alguno de los
witness?
colegas tiene alguna pregunta?
Seeing none, thank you for your testimony.
Señor,
And
gracias
thank you
por
so
su
much
testimonio.
for translating. We're going to
You're
have
welcome.
you stay. We have a next testimony coming.
Ok, todo el mundo tiene los audífonos. Todo el mundo que necesita traducción. Si necesitas
So we're transitioning to the headset now.
Básicamente lo que va a suceder es, nosotros hablamos en inglés y si tienen los audífonos se escucha lo que nosotros estamos diciendo en español. So, si necesitan un audífono o un headset, como lo llamen, alcen la mano para poder saber.
Okay. Okay.
Pausing the hearing while headsets are being distributed.
We are just
How many do we need?
distributing the headsets, so we will take hopefully a very, very short pause. Again, sorry for the delay because we were not aware of the need for translation, and now we are, and we do have those available. However, what we wanted to do was proceed with this hearing, get all the testimony in, then we want to sit down with you and make sure we understand your concerns before we actually vote on this bill to get it out of committee. So at the call of the chair, I will hear all of you, recess it, have a conversation with you, and then we will convene again for my colleagues to vote on the recommendation on the bill. Can you say that?
Todo el mundo entendió eso porque tienen los audífonos puestos, ¿verdad? La concejal he decidido de que porque hay confusión, porque yo estoy recibiendo diferentes mensajes también de cuál es el entendimiento de esta legislación y porque no estuvimos preparados para tener a tantas personas aquí que no entienden el inglés. Y por los mensajes que estoy recibiendo también hay personas que no entienden el proceso. Ella ha decidido de oír todo el testimonio que hay hoy y después vamos a tomar un receso. Ella se quiere reunir con ustedes como grupo para oír directamente cuáles son las inquietudes y después ella llama al comité de nuevo para poder tomar una decisión en cómo vamos a votar y si el bill sale de comité o lo continuamos para más conversación, ¿ok? ¿Estamos claros? Okay.
Thank you so much, Council Member. So just so we are clear, this bill, we're going to hear all testimony from everybody. This bill is only about changing the fine structure, not a conversation with what the health department does. That's a separate conversation, how the health department does their work. My bill is just about changing what the fine is. That's it, nothing else. So would the clerk please call the next witness to testify on this resolution?
Dr. Andy Tan, Associate Professor of Communication at the Annenberg School for Communication at the University of Pennsylvania.
Good afternoon. Thank you so much. Please state your name for the record and proceed with your testimony.
Good afternoon, Chair and members of the committees, as well as our community members in Philadelphia. I am Dr. Andy Tan. I'm Associate Professor and Director of the Health Communication Equity Lab at the University of Pennsylvania's Annenberg School for Communication. I'm also Senior Fellow at the Leonard Davis Institute of Health Economics at UPenn. Thank you for the opportunity to testify in support of Bill 250213, which would increase the penalties for retailers who sell electronic smoking devices and unapproved nicotine delivery products to minors. This will restrict an important source of such products to young people in our city and reduce tobacco disparities among young people in Philadelphia. The views expressed today are my own and do not necessarily represent the official opinion of the Annenberg School, the University of Pennsylvania Health System, or Penn Medicine, or the University of Pennsylvania. As the principal investigator of multiple NIH-funded studies examining tobacco prevention and control interventions among youth and young adults, including a recent FDA and NCI-funded study of the impacts of Massachusetts' comprehensive flavored tobacco ban, I bring both research expertise and evidence-based insights to today's discussion. My testimony today will focus on why this bill is a crucial step to protect Philadelphia's youth from accessing addictive nicotine and tobacco products and the health harms from these products. Retailer stores are significant places where young people are exposed to tobacco products and marketing and advertising. They are also where underage youth obtain tobacco products such as e-cigarettes, even though sales to minors under 21 are illegal nationally. Research among US youth have found that in 2021, US middle and high school students in this population, almost 2 out of 3 students, or 65%, reported seeing tobacco product marketing of e-cigarettes, cigarettes, and other forms of tobacco products every time they go to a convenience store, a supermarket, or a gas station. Youth who have never used any form of tobacco and frequent convenience stores at least once a week have 80% higher odds of initiating vaping over a 2-year period. This is explained partly by their repeated exposure to retail e-cigarette advertising in retail stores. In 2022, among 15 to 20-year-olds in the US who use e-cigarettes, over 2 in 5, or 43% of them, said they obtained their e-cigarettes from a retail store, although the legal age of sale of tobacco, any form of tobacco products, is 21 nationally, effective in December 2019. Tobacco and e-cigarette use is not an equal opportunity risk factor among all our youth. Exposure to marketing, access to tobacco products, tobacco use, and the related health problems are more prevalent in some groups of youth than others in Philadelphia. Let me share some statistics from our local youth health information. Tobacco advertising is prevalent at retail outlets, particularly in low-income and racial ethnic minority neighborhoods. Licensed tobacco retailers who accept SNAP and WIC programs assistance have between 1.6 to 2.1 times higher odds of having exterior tobacco advertising, and they have 1.7 to 3.4 times higher odds of having interior tobacco advertising than other types of retailers. What does this mean? It means that youth in lower income and racial and ethnic minority neighborhoods are more likely to be exposed to tobacco advertising in these retail outlets. In 2023, on average, 18.5% of all high school youth in Philadelphia currently use e-cigarettes. But we see higher rates than this average among certain groups. 21.4% of female students, 20.3% of Hispanic or Latino students, 32.5% of those who identified as multiracial, and 24% of LGBTQ students currently use e-cigarettes. Philadelphia has over 2,500 licensed tobacco retailers, and 90% of public schools in Philadelphia are within 1,000 feet of a tobacco retailer. This is higher than the national average of 63% in a study among 30 US cities. Lower income neighborhoods, based on census-tract information, have higher tobacco retailer density than higher income neighborhoods in Philadelphia. These disparities are not accidental. They result from decades of the tobacco industry's targeted marketing of their products to vulnerable populations and the systemic inequities in retail environments. With this background, it is significant that the proposed Bill 250213 will require graduated fines for individuals and retail outlets in violation, ranging from $250 for the first offense to $2,000 for subsequent violations, and ceasing sale or operations for repeat violations. This approach.
Can I interrupt you 1 second, just to clarify? We have an amendment to the bill that we are considering, and we have to actually change those levels of the fines back to maximum being 2,000 because we have to stay within, so we don't preempt the state law. So hopefully at a later date we can do higher ones, but right now we are adjusting back as our amendment articulates. The highest level will be 2,000.
Correct, and I've updated my testimony to match that range as well.
Wonderful, thank you so much.
This approach, focusing on penalizing the sale by retail outlets, aligns with the earlier research I've shared with you. It will benefit youth by preventing them from accessing addictive nicotine and tobacco products, including e-cigarettes from retail stores. It will particularly benefit public school students, youth of color, and those living in lower income neighborhoods who have greater tobacco retail density and who are at higher risk of starting and using e-cigarettes. The bill's provision of allocating 50% of collected fines to youth vaping prevention and education programs is particularly important. Comprehensive approaches that combines enforcement with education yield the strongest results in preventing youth from using tobacco in the first place. Using fine revenues to fund culturally appropriate prevention programs and partnering with youth organizations serving youth of color and LGBTQ youth and those living in the most affected communities will be a much needed strategy. I want to highlight specific recommendations based on my own research within my lab among key stakeholders following the Massachusetts 2019 statewide flavor ban, which also included increased retailer fines for violations up to $5,000 to ensure equitable implementation and enforcement for the proposed policies for our communities here in Philadelphia. Ensure that smaller retailers within communities of color are educated about the high fines in the case of violations in advance of implementation dates. Publicizing the high fines that are issued to a retailer who has failed to comply with the law may encourage better compliance among other retailers later. Providing culturally and linguistically sensitive educational materials for retailers, such as materials in multiple languages, ahead of enforcement. Taking steps to prevent any unintended consequences, such as unfair policing among or within communities of color, will be needed. This is to ensure that the Public Health Department and compliance officers are aligned with the policies to penalize underage sales and not to penalize individuals' possession, purchase, or the use of tobacco products. Monitor violations and fines by communities to ensure that certain communities and retailers in those communities are not unfairly targeted for enforcement. Funding for equitable and adequate enforcement efforts should be allocated fairly across communities so that those with higher use of tobacco have equal opportunity to protect their youth populations from accessing these harmful products. To close, the tobacco industry currently spends $8.6 billion annually on advertising and marketing cigarettes and tobacco products. This is close to $1 million per hour. Most of this spending is on promotions to retailers. In Philadelphia, a middle school student in a low-income neighborhood in North Philadelphia will be passing 16 tobacco retailers along their 3/4-mile walk to school. Every time a retailer sells tobacco products to underage youth, knowingly or unknowingly, they become a partner in the tobacco industry's effort to addict a new generation to nicotine and tobacco products, particularly among our most vulnerable youth. This bill represents a crucial step in preventing and protecting the health of Philadelphia's youth from addictive nicotine and tobacco products and the physical and mental health harms from these products, especially those who face the greatest risk due to the predatory tobacco industry practices. The enhanced penalties and enforcement mechanisms in Bill 250213 will be an important first step to ensure that Philadelphia retail outlet owners and their staff take their responsibility as community members seriously. Thank you for your attention to this critical public health issue and uplifting the health of youth in Philadelphia. I'm happy to answer any questions about the research evidence supporting effective ways of health education strategies to share insights from our studies.
Thank you so much for your very important testimony. We got a lot of information. I appreciate that. I'll have my colleague ask a question, and
My question is actually for the previous testifier from the administration, because you gave some facts in terms of the number of retailers that exist in Philadelphia, tobacco retailers. And I just wanted to ask the administration if you could come back forward, because we enacted legislation when I was formerly the chair of the Committee on Health and Human Services to reduce the number of tobacco licenses that were issued in the city based on the saturation of so many sites. And, you know, I was just reminded of that based on his testimony. Can you talk about that a little bit? Has there been a reduction? Are we still issuing licenses in these saturated areas?
I'm sorry.
Yeah, it's on.
Thank you. Yes, Councilmember, you're referring to the 2016 Board of Health regulations that set density caps on retailers. And
Yes.
we've done like preliminary evaluations on that, and we can share those with your offices, but the number of retailers has gone down since that regulation was passed.
Okay.
There's differences across the districts in terms of, you know, the density still, but that's what I can say off the top of my head.
Okay, because I was disturbed by, that Philadelphia has over 2,500 licensed tobacco retailers, and 90% of public schools are within 1,000 feet of a tobacco retailer, which sounds like, almost like the same numbers from when we did the bill in 2016. It doesn't sound like this number has changed significantly.
I think those are old numbers, yes.
Okay, okay.
And before you go to the point of making sure we get the data to see, because I'm sure you also have a map to show where these are concentrated. That's the data we would like to see, is to see not only at the level of licenses, how many are there, where are they is also going to be very important, because the whole issue of density is, I want to make sure that the density issue is addressed in the neighborhoods that this Dr. Tan spoke about, right? We want to make sure that we don't have a prevalence there, and hopefully that's where you're looking at your license reduction to make sure that even out for all of the city, how many retailers do you have, whether you do it by census tract or however you do it. We would like to see that data as well, like a heat map of what's going on.
Okay, absolutely.
Thank you, thank you. Dr. Tan, we'll go back to you. Are you done,
Yes, I am.
Cindy?
Thank you.
Okay. You cited, you know, Massachusetts flavor ban and penalty escalation. We are not doing a flavor ban. We're just looking at changing the fine structure.
Yes.
Could you share if any lessons there are about equitable enforcement? Because that's, you mentioned that in your testimony, that we should be cognizant of that, right? And I want to reiterate again, we are not wanting to hurt people's businesses. What we want is people to follow the law and not hurt our children, right? So in that space, I want to see how equitably one can do that.
Absolutely. In some of the recommendations that I provided in my testimony, these are steps that are taken in Massachusetts to make sure that the retailers are informed way in advance of the start date of the enforcement with culturally and linguistically appropriate materials for the retailers ahead of time. And they have also implemented a so-called soft launch version of their enforcement period, where retailers are given verbal initial warnings before the actual penalties are enforced in terms of the fines. So those are just some strategies ahead of time to ease in the communities, the retailers in specific communities ahead of these raised fines and penalties.
Thank you. And I want to pivot back to the health department. Given this testimony about how intentional have you been in the past, and we would like you to be going forward once we are able to get this on the books, in terms of informing our business association, our businesses about these changes. And is it done in a culturally competent manner? And how and if you have any data around that from previous bills that might have been passed to address youth access to tobacco?
Sure. We certainly do prepare materials when new bills are passed to inform the retail community, and we can pull some examples and work with your office if this passes.
Yeah, we just want to make sure that we're not checking boxes, but we're actually working with our business community to say, this is what we passed. This is what you need to do, and these are the consequences if you don't, but giving them, making sure they train their staff, they are trained themselves, and they understand the consequences of this. I'm trusting in our people to say they're not doing these things intentionally to hurt children, right? So I just want to make sure our business community understands we need you to be a partner in making sure we safeguard our children's health, right? And that's why we would need a process for them to understand the bill, what exactly the penalties are, what has changed about them, and making sure they comply so they don't have to pay those fines. If you comply, you don't pay those fines. If you make sure people are carded and are not sold if they're 18 or younger, no fines are paid, right? Because this is not a revenue generator. This is about making sure we're safeguarding our children's health. So I would love to see what sort of a campaign the health department does or have done in the past around issues when there's been a change in what the retailers have to comply with.
Okay, I think the latest one, and we did something around hookah establishments that we could share, but I have to defer to some of our outreach people on that, but we can get that to you.
Yeah, because that's going to be the devil in the detail, right? We can pass as many bills as we want, but how are people complying? Are they understanding? Is going to be the real issue post passing the bill. Thank you very much. We'll just go back to Dr. Tan. Do you have any question for Dr. Tan?
Thank you for your testimony today. Obviously, we can see that there's a language barrier as it relates to policy and process. So my question to the admin is, what are we doing when we are putting these policies and processes in place? What are we doing to ensure that businesses who don't speak English are notified and educated around what these requirements are, right? We had a community member that was translating who now had to leave, and so I believe this is part of the breakdown that some of our businesses experience. And if we're saying we're open for business and we want businesses to be responsible, then as a government, we need to ensure that we are making these processes and policies, that we're putting them in place in a way that they're able to understand it. So what are we doing to do that? What are we doing? You know, they feel targeted by health department. They feel targeted by license and inspection. They don't understand the process of state tobacco requirements and city tobacco requirements. So there is obviously a disconnect when it comes to the entire conversation around tobacco sales and what their responsibility is.
I may have to defer a detailed response, but I know that when you apply for a tobacco retailer permit, you have to renew every year, and we have an education module that is required to be taken with that renewal or with any new application, and that material is translated into multiple languages per city policy.
Thank you.
Any other questions? Thank you so much for your testimony. We'll ask the clerk to call up the next witness panel.
Jacob Zaitchik, Community Advocacy Director, American Heart Association.
Thank you. Please state your name and begin your testimony.
Jacob Zaitchik. Dear Councilmember Ahmad and members on the Committee of Public Health and Human Services, on behalf of the American Heart Association, thank you for the opportunity to provide testimony on Bill 250213, which would amend Section 9-633 of the Philadelphia Code entitled Sale of Electronic Smoking Devices and Unapproved Nicotine Delivery Products. Thank you once again for the opportunity to provide testimony. 38% of youth have tried and 19% are currently using e-cigarettes. Each year, the tobacco industry sells over $300 million worth of their products in our city. 74% of e-cigarette sales are flavored products. Research has shown that most teens start using tobacco with flavored products. These products are appealing to young people, and many mistakenly believe that they are less harmful. We want to thank Councilmember Ahmad and actually all 17 members of the Philadelphia City Council for recognizing the importance of addressing youth e-cigarette use and co-sponsoring this important legislation. The American Heart Association is supportive of the intent of this legislation. This bill would increase the monetary fines levied on retailers who repeatedly sell e-cigarettes to underage individuals. It would ensure that a percentage of revenue from those fines is spent on evidence-based youth e-cigarette prevention resources and does not penalize our youth for the purchase, use, or possession of these products. Unfortunately, at the American Heart Association, our guidance is a little bit stronger than the current legislation, but due to preemption, we understand some of the challenges that the City of Philadelphia faces. We'd also like to clarify that the current federal law prohibits the sale of tobacco products to anyone under the age of 21, and that at the federal level, there is no exemption for active military personnel or veterans of the military at the age of 18 years old. The American Heart Association would also like to reiterate that there is no safe tobacco product. We do ask as we move forward in these conversations that we ensure that retailers who sell any tobacco product to underage individuals are all receiving the same penalties around enforcement. Thank you for the opportunity to testify on behalf of the American Heart Association. We would like to thank the Philadelphia City Council and the Health Committee for their urgency in addressing the youth e-cigarette usage. This legislation specifically outlines how we'll invest in youth e-cigarette prevention, ensures that our youth are not penalized, and increases fines on retailers who repeatedly sell e-cigarettes to our children. We do hope that the City of Philadelphia can work closely with us moving forward to address this epidemic on e-cigarettes and ensure that retailers who sell any tobacco product, not just e-cigarettes to our youth, are receiving the same penalties moving forward. Thank you for the opportunity to provide testimony, and I hope everyone has a wonderful weekend.
Thank you for your testimony. Thank you for your testimony. I'm sorry.
All right. Oh, he left. Just come back for a minute. I have a couple of questions for you. So I wanted to just understand the legal challenge. You know, we're faced with legal challenges, which is why we like to be much more ambitious, and we're dialing it down for those reasons. So license revocation, how do you reconcile the deterrence benefit with the risk of legal challenge or administrative backlog that might follow from automatic revocation? Has other places encountered that?
Thank you so much for the question. I think it would be a great opportunity for the City of Philadelphia to, and I know the Health Department and others, through some of their coalition work, to connect with some of, like-minded colleagues in other cities who have faced some of these efforts and challenges. I know, for an example, for the Smoke-Free SEPTA initiative, we were connected as stakeholders and decision makers with other cities across the country who had faced those challenges. So I think that a role the American Heart Association could be helpful in convening other elected officials, decision makers, to kind of discuss some of the challenges faced. I will just note, at the Heart Association, we do understand, our national kind of best practice and guidance and the challenges that the City of Philadelphia faces due to preemption. And just want to also acknowledge not just the City of Philadelphia, but all municipalities in the Commonwealth face these same challenges as they look to address cigarette use and vaping.
Well, that's something we have to do collectively in the entire country, because tobacco has a stranglehold on us, clearly. Anybody else have any questions for this witness? Thank you so much for your testimony.
Thank you.
Now, So now we're going to transition to the public comment session. Please note that the time limit for each speaker is 1 minute. Mr. Sham, would you call the first speaker for public comment?
Sorry, Mahia.
Good morning. I didn't know we were going to have 1 minute only to speak today, but
You can submit your testimony in writing, and we can take the whole thing. If you can just summarize your
okay, perfect,
testimony.
perfect.
Yeah.
Will do. So, good morning, Chair, members of the council, and fellow citizens. So, my name is Saudi Mejia. I want to submit testimony in opposition of Bill number 250213. I'll summarize. So, I have a personal connection to this. My father is a grocery store owner in Philadelphia for over 30 years. It's a family-run business. He served the community and through any economic activity and neighborhood changes. Recently, his tobacco license was not renewed, and I'm actually an attorney, and so obviously I tried to help my father out with appeals. I appealed to the board, and even there, the board, even though I had testimony that, or actually proof that the violations, the citations were incorrectly filled out, they still upheld their decision. And also, another issue is when citations are given, they're given, some of them are given 3-4 months down the line. And the store owners only have camera footage for maybe a month. So imagine, let's say you get an Easy Pass ticket and you get the ticket 5 months down the line. There's no way for you to really go back and try and prove, well, I didn't go through the Easy Pass. Now you get a $250 fine. So imagine now, with this bill, the fine is increased to $1,000 or $3 or $5. Well, I saw that now it's going. Yeah, I heard that it's the maximum is going to be $2. On top of that, there's going to be a sign or a poster that needs to be put on the business saying that this establishment sold to a minor or without an ID, which I understand. None of us here, we're not trying to sell tobaccos to minors. No one wants that. I mean, I have a child. I don't want her, buying tobacco, obviously. But you got to think of the 14, 16-hour days that these store owners have. And if it does happen, hopefully it doesn't. Hopefully, there's something that it's just a mistake. And that's what it is. And just penalizing, making a fine 4 times the amount just seems excessive. Also, there are some preemption issues with this law. But imagine, I spent about 60 to 70 hours working on my dad's case. I looked up last night. The average attorney in Philadelphia charges $300 to $759 an hour. Just going on the low end of $300 an hour, you're looking at $18,000 to $21,000 for an attorney. Meanwhile, your store, your business, what you live off of, is closed for 6 months or while you're going through an appeal. And you get I thought 5, but now $2,000 fine. So you have to pay the $2,000 fine. You can't pay your employees, and you have to go and pay an attorney almost $20,000. At that point, it just seems like it's a target to those businesses. And I just want you to understand that this is going to hurt them. And I'll wrap up.
Yeah.
And we believe, it is a due process violation. So in all fairness, we want to, instead of looking at the punishment, we want to maybe expand the enforcement powers and introduce, or not expand, instead of expanding enforcement powers, introducing punitive measures, we want to focus on fair and transparent consistency of enforcement.
Oh, We thank you
thank
for
you.
your testimony, and I just wanted to say, all of this would be obviated if people checked IDs. That's all we're saying. Check the IDs, 18 and under, don't sell. So it is up, there's a responsibility all the way around. But I do hear you about how the process works, and as I said earlier, and my colleague translated, we're going to recess this meeting soon after you're done with everybody's testimony, and we're going to have a conversation, because my bill doesn't address any of that. This bill is not about the process. However, I hear that the process is important, and we're going to get some clarity on the process from the health department with you, with all of us. But this bill is going to proceed because you have the choice just to card people and not sell the product. But I do understand once the violation has happened, how to have clarity about that. We are 100% there with you to make sure people understand, because deterrence is a very good way of stopping behavior. We know this. You have a traffic red light camera, you slow down.
Exactly.
It works. Human nature, it works. So thank you for your testimony. Please submit your written testimony if you have. There's
Will do.
a question from
yes.
our colleague, my colleague.
Thank you. Good afternoon.
Good afternoon.
I just had a question for you. You said that, that a merchant in some cases may have had a visit, let's say from the health department, and then months later received a violation.
Yes, multiple times. Actually, so my dad received about 6 tickets. 4 of them was received 4 months later. And I requested a hearing, and I never actually received notice of the hearing as well. So there was a lot of due process violations just in that aspect. And I actually brought my dad's case, half of it, because I didn't want to carry it all, just so you guys can see the complexity of these matters.
Okay. How did those citations come? Did they come in the mail?
Yes, they
Okay.
came in the mail.
Because that's something we can actually do something about in terms of legislating a requirement that you know, if it's not sent out within a particular amount of time,
And
then you can't collect. You know, it's like coming back 6 months or 6 years later, might as well be, to try to collect. And also you mentioned something about stores closing, which I found interesting because in my experience, the city of Philadelphia doesn't close stores, or if they close them, it takes a really long time. You know, I've worked on nuisance business issues in my district for a long time. We have some that are just flagrantly doing whatever they want to do, and getting the city to do the level of enforcement, whether it's health or L&I, it just, in my opinion, it doesn't happen, and it doesn't happen nearly as quickly as it needs to happen. So I was surprised to hear you say that we're closing stores, because
Yeah, so they actually did close, so after the tobacco license wasn't renewed, within a week, an inspector came by. All the cigarettes were actually in a black garbage bag, and the inspector went behind the counter, opened the garbage bag, saw them there, and said, I'm giving you a cease of operations, just
Okay.
because they were on the premises.
yeah, they can't be on the premises.
And I understand that,
Yeah,
but
yeah.
they were collectively, you know, taking them to whoever, wherever, disposing of them, to be honest.
Okay.
So, and that's what led to that. I can't speak for anyone else, I can only speak for this case
Okay.
particularly, but yes.
Okay, all right, thank you.
All right, thank you so much. All right.
Thank you for your testimony. Sorry, my colleague has a question.
I'm sorry. So I want to kind of follow the same line of questioning that my colleague, Councilmember Bass, just asked you. You said that they issue a violation and that you don't receive it for several months. My question is, how easy is it, for instance, for a business to then prove their case if they are in disagreement with that violation? And I ask the question because I know from visiting some of the businesses that their camera roll doesn't last that long, right?
Exactly.
And so what are some of the challenges that some of the businesses experience having to prove or appeal a violation that they've received?
It's actually, so if the violation is given to them immediately, which I think that should be the course of action. When you receive a violation, hey, have the inspector walk in there. Here, you just sold to this person. and there's accountability right then and there. For a lot of businesses, the camera roll deletes after a month. And I go back to my Easy Pass example. Imagine you have a dash cam and it deletes every 2 weeks or every month, and then you go down the line and 3 months later you receive an Easy Pass ticket. It's very difficult, and a lot of these store owners, I mean, they don't have any knowledge in IT, so now they got to call the company that installed this camera system. They're booked, or they're installing another camera system, and it just takes time. So if we don't have that camera or footage, you can bring everyone in the entire neighborhood, and it's just it's impossible to actually prove.
And have you guys has any of the businesses that you represent ever been shut down just for a tobacco violation, or has the tobacco inspection then triggered a follow-up inspection that has caused for the closure? I only ask that, Madam Chair, because I've never, no one has ever reached out to me about them missing it or failing a tobacco violation that has caused the closure, right? So is it because of the tobacco violation that they're saying they've been shut down, or they've been shut down because the tobacco violation has triggered another type of inspection?
So in the case I referenced, I guess the non-renewal maybe triggered another visit. And it was about a week later. It might have been days later. And then I did have another case where there was two, not cartons, but I guess boxes, like a pack, 2 packs of cigarettes that maybe it was just left there, or the owner didn't see it. For some reason, the health department came by to just inspect or whatnot. They saw the 2, and they did give them a cease of operations. And this was like at 7, 8 o'clock in the evening as well.
Okay, thank you.
Thanks.
I just wanted to make sure we put
Before
that on
you,
the record.
just for the record, so it was a compliance issue. They got a cease and desist for selling tobacco, and that was a violation of that, violation of the violation.
So in either case, they were not selling. It was on the premises in a
So there
black
needs to be
trash
some
can.
clarity in saying when you have been found, when your license is being revoked, you may not have any tobacco product in the store, and we must make that clear. But our retailers also must understand they have a responsibility. This is about shared responsibility,
Yes.
right? This is, as you said, nobody wants their children to become nicotine addicts, right? Unfortunately, adults do that, but we don't want our children. But I just want to make sure people understand there's a shared responsibility with government and with our retail establishments to understand they have to work together. We can, we'll have conversations around the health department and how they, the way they do their work.
Yes.
And once again, I will say, this is about the implementation part of this bill. This bill is to wake people up, red light camera up there, better watch if you're carding. That is going to be something we're going to be behind to do, but we want to make sure you have resources to make sure you can comply. So thank you again for your testimony.
Thank you guys for your.
If the clerk would call the next witness.
Francisco Rosario and Raul Serrada.
Raul Serrata had to leave because he had a parking issue.
Please state your name and proceed with your testimony.
Good morning, council members. My name is Francisco Rosario. I am the Director of Community Outreach for the Dominican Grocers Association, nonprofit, and Director of Constituent Services. I would like to make you aware that DGA is a 501c3 nonprofit with the IRS, and we have never received any funding from the state government or anything. We're doing everything volunteer. I am a volunteer, full-time volunteer. I don't make any money for being here right now. I'm losing money for being here right now. First, I would like to respectfully tell Ketsi, who's a friend and collaborator, that we did, as soon as we found out, like I said, mentioned earlier, we emailed your office, 2 people, specifically a person from your legislative team and then somebody else. We emailed Nina Amat's office, and we made everybody aware. Even the mayor's office got notified, and they said, we are not the proper audience, you should reach out to Nina, and we did. Now I'll begin my testimony. My name is Francisco Rosario, and I serve as the Director of Community Outreach for the Dominican Grocers Association and Constituent Services. On behalf of our members, I appreciate the opportunity to testify today and share our concerns regarding Bill number 250213. I want to tell you a little bit about the DGA. We represent over 2,500 independently owned grocery store owners across Philadelphia. These family-run businesses are vital to their communities, providing fresh food and essential goods, especially in food deserts. They create jobs, contribute to the local economy, and serve as trusted neighborhood hubs. Collectively, our members contribute millions of dollars in taxes to the city of Philadelphia each year. Key concerns with the bill we have: while we respect the council members' intention, this legislation presents serious unintended consequences for small grocers, unjust violation claims, and due process violations. We want to be clear. We do not condone selling tobacco to minors, nor do we believe that those who do so should avoid punishment. However, we received numerous reports of due process violations in the enforcement of these regulations and also the investigation. I don't know if the city council is aware, but the city contracted a third-party agency that does investigations, that brings minors into these stores to buy tobacco, just like the DEA would do with a drug case, right? It's a little bit of entrapment. Our members feel a little bit that they're being entrapped. And like my colleague, Sauri Mejia, the attorney, he said that there's reports of fabrication of tickets. There's things I'm aware of personally where I've seen video footage that at 9 a.m. on March 25th, 2024, there was no sell tobacco from 9 to 10, and there's a ticket at 9:30 a.m. saying that person sold tobacco. So we need to investigate that. And we had 2 meetings with the director of health. We also had a meeting with the supervisor for the tobacco department, and nothing has been done yet. Citations are often issued 3 months later. That's what the attorney says, so I'll skip on that. The burden of proof falls entirely on the grocer, and only viable defense is security footage is typically erased 30 days. City council passed legislation that you need an attorney if you're an LLC or a corporation, and they force people to incorporate. Now, those people need to pay $700 to $1,000 or maybe more to an attorney to come represent them, to just present a video to show that they didn't do it. They can't represent themselves due to the corporation and LLC law. The third-party agency responsible for investigations conducts investigations by bringing minors into the stores to attempt to purchase tobacco. This practice raises concerns about entrapment, and it makes hardworking, small businesses owners feel like criminals. I want to add to the prior statement so basically, I'm personally aware of friends of mine who got their business shut down just for selling tobacco to a minor. After a certain amount of violations, they get shut down for 2 weeks. Of course, we can talk about preemption issues, where I want you guys to look at preemption issues and the authority for city council to do this under state law. Focus on the investigations, the third-party agency, due process violation, which is we could sue federally for this. I think higher government should restrict authority from city council due to preemption issues. I already mentioned that. Other things that will affect the members is excessive fines could lead to closures. The bill increases fines up to $5,000 for repeated offenses, an unsustainable financial burden for small businesses. I would be okay if you're giving tickets and you're closing them and giving them a $5,000 fine if they did it. But I personally seen it where our members got tickets and then they fought it and then they won in front of the board. There's fabrication of tickets. Well, that's an allegation, you know, that's our members' concerns. Risks for closure for minor infractions. The Department of Health could shut down for up to 60 days. That's what we believe with the new bill. Even for minor infractions, causing devastating financial losses. 60 days for a bodega to be closed is detrimental. That will shut them down. Disruptive inspections. Mandatory quarterly inspections over 2 years will place undue stress on small business owners, many of whom already operate with limited staff. We respect Councilwoman Ahmad. You mentioned it several times at this hearing, you're only increasing fines. That's not what you're doing. You're doing much more than that, okay? We need to review that bill. If you want to increase fines, go ahead, but don't do the other things that are going to affect us, okay? Reputation damage. There's also going to be a requirement for businesses to publicly post violations for 90 days that could potentially harm their reputation and customer trust. I don't believe customers are going to trust a store that has a city-issued notice saying, I violate city code. We're not criminals, there's just a city code. And what if that grocer did not sell to a minor and he unjustly got, convicted or whatever? A call to fair solutions. We urge the City Council to work with us on enforcement solutions that protect public health without threatening the survival of small grocers. The DGA is ready to collaborate to ensure regulations are fair and effective. A couple more notes, just 30 more seconds.
You can submit your written testimony
Okay.
if you've gotten to that.
One more second, please. So I would like to make you aware that they need attorneys, $700, and the ticket's only $250, so why don't I just pay the ticket instead of the attorney, right? But that means you have repeat offender. Unjust violation claims and due process violation, third-party agency that we believe is incentivized to give as many tickets as possible. Excessive fines, okay, due process violation, disruptive inspections. Before they enforce the new bill, change the way it's done. Why are you having a third-party agency do the investigations? One last thing I want to point out, that the only defense that you have in this kind of case is video proof that you didn't do it, which deletes after 30 days. The due process violation comes in when you give it to us 3 months later. I know people personally who did that. There's a guy sitting here right now who beat it right there. Miguel Torres, levante su mano. He actually received a violation. I seen the video, and he did not sell tobacco to a minor. We have the video still if you want to see it. And he beat the case. So who fabricated it? Who made it up? Stop treating us like criminals. That's what we feel like. We feel like the city is against us. Mayor Sherelle Parker, who I know personally, said we're open for business, right? But it seems like you're trying to close all small businesses down and let Wawa operate. Thank you. Have a great day.
Thank you for your testimony. Don't go, because as I said, and I'll say it again, simple solution. Guard your customer, don't sell to 18 and under, no fine. No video, nothing needed if you follow that rule. That is, I'm gonna tell you, undoing the harm that vaping does to a child's lungs. Some of it cannot be undone. So I hear you about, these are big fines, but we have a very simple solution. Make sure you check who you're selling to. We don't have. And the second part, you talked about the time. That is something definitely we want to talk to the health department to follow up, to make sure that you're able to produce evidence once you have been found to violate, to make sure, if, as you said in this case, that it was not true. The third party issue, and again, the health department, we will discuss this with them. The reason for doing the third party using minors with an adult nearby is to actually find people who keep violating and keep selling to young people. However, it has to be accurate, so I hear you. I hear you when you say that the evidence needs to be clear and real, and we will definitely follow up with the health department to understand how that could have happened, how he could have been ticketed for something that did not happen. So we can get to the bottom of that. But the point is, these fines are, like I said to the previous witness, this is like a red light camera. Red light camera tells you to slow down. We have seen enough evidence that it does slow down people, and we do save lives. Same thing here. This is a red light camera. Do not sell to minors. No fine, and children will benefit from that.
Councilwoman, I will respectfully say again, before you keep enforcing it, before you amend a bill from, 2015, you should really look at the fact that a lot of our members have lost their license for allegedly selling tobacco to minors, and they have not. I seen the video personally, Councilwoman.
I hear you. I hear you.
They are
about
fabricating
that.
violations. That's not okay.
No, that, I agree with you. That is not okay. It has to be proven, which is why when I asked the health department, why does it take time to actually issue the ticket, that was to verify that the ticket was needed to be issued. They were doing their due diligence. But if it's more than a month, I hear your issue about cameras. Those are things, that's the implementation end. But the red light camera approach to this doesn't change. We still have to look at how well it is implemented. We don't want our businesses to suffer. We want them to make money, pay their taxes, and we get more money in the city to do good services. We want you to survive. I'm a small business owner myself, so let me be clear. Too much regulation is not good, but this is a red light camera issue to save our children's lungs. Let me be clear. Many of you have children. You don't want them to be sold under 18 products that were going to hurt them. I know that's what you want. So we want to work with you to make sure, but just like I'll be like a broken record, when we put those cameras up, people stop speeding and people stop dying. Roosevelt Boulevard, people stopped dying because people would stop speeding.
Okay.
So that is exactly what we are doing. I appreciate, your passion about, representing your members. I hear you. Can we make the process better? Of course. How will the implementation occur? We need to talk to the health department. But we also want to hold all of us accountable in this process. All of us have to do the right thing. And so I really appreciate your passion in coming here, and we'll have a follow-up conversation, as I said, before we are going to actually vote on the recommendation. That's the commitment I'm making to you, and we'll follow up as soon as this hearing is over. All right, thank you. Does anybody have a question?
I just
Yeah.
wanted to make just a follow-up statement.
Yeah.
But I would just, you should, just going back to what you said, that you felt like it was entrapment, I would assume that everyone is a minor. Assume that everyone who comes in is a minor. Card everybody. Listen, sometimes some stores I'll even go into and, look, they may card me. I'm no minor. But they may, I know I look like them. No, just kidding. But they don't laugh so hard.
You should say yes.
Yes,
You should say
I
yes
did say
very
yes.
loudly. All of us look like minors.
Yeah.
All of you do look like minors. I'll check all of your ID.
But some people, but that's the point. Some people, some businesses check everybody, even though it's apparently clear, abundantly clear, that the person before them is unlikely to be a minor, very much unlikely. I think that the policy really should be just card everybody. And that way, like if that's the policy, there's no way that someone can come in and accuse anyone of doing anything that's inappropriate. What was the other point that I was making? I'm sorry, I didn't write my notes down. For those who have received a notice that they will be closed for selling to minors, if you feel that has been inaccurately assessed against you, that notice has been assessed against you inaccurately, then feel free to reach out to your district council member. Feel free to reach out to us and say, help. We need some help. And let us help you navigate, because what we don't want to do is target particular businesses and the information that we're receiving is not factual. We want factual information, and we want to be able to also be able to help you. So, but we don't know if you don't tell us. Please don't assume that we got the notice that we're shutting down this business at XYZ location. We don't know. So we need for you to tell us, reach out to us, and let us know.
Thank you,
Thank
Councilwoman.
You're
Thanks,
welcome.
Council Member. And also, I would actually, after this, like to follow up about the one person who was found not guilty. We'll talk later, because I want to bring it up with the Health Department. How did it happen? Because that'll teach us how to improve the system. And so we will, you're talking to a scientist who's going to understand the process to make sure it's better and fair for everybody. Any question?
I just want to also put on the record that I think it's important for the group to also have a meeting with the Health Department, not just by yourselves, but with Councilmember Ahmad, who is the chair of this committee, so that she's also able to hear and better understand what some of your challenges are, as well as what some of your experiences are as it relates to the Health Department and what their commitment is, right? I think that there are a lot of concerns around tobacco and the process as it relates to the city as well, and as compared to what is happening at the state level. Because I've heard from many of you who are frustrated with people who are selling tobacco, not just to minors, but who are selling fake cigarettes
Yes.
too, right? False tobacco products. And so I think that we have to have a better form of communication
You're right.
to be able to better advocate for you as it relates to city process, right? But we also have to do better in trying to figure out how the business community who sells tobacco products is better informed as it relates to state and city policies, right?
Yes.
And how they're impacted. Because I've never heard of a business being shut down for just a tobacco violation. So there's something that I really want to follow up on to better understand what exactly happened and what was the process.
Can I say one more thing?
Yeah, please. And then we have to wrap it up.
Yes. I know business owners, a lot of them who are present today, who ID everyone. En some, levanten la mano si ustedes le chequean el ID a todo el mundo y le han dado, espérense, y le han dado una violación de que ustedes le vendieron a un menor. I ask, raise your hand if you never sold tobacco to a minor and you got in a violation. Levanten la mano. One last thing, Councilwoman, with all due respect to the metaphor that you use, if I run a light in the city of Philadelphia, I'm not at jeopardy of losing my license, my driver's license, because it doesn't affect points. But if I allegedly sell to a minor, I get shut down for 2 weeks, okay?
Yeah,
That's
well,
the difference.
I hear you.
That metaphor
Listen,
is not valid.
Speeding can kill, tobacco selling can kill, both of them. So red light analogy holds. Thank you so much for
Thank
your
you. Have a great
testimony.
day.
We'll be in touch. If the clerk would call the next witness up, please.
Yeah, Miguelina and Benito Bravo. No?
Okay. Next. Oh, are you here, Nicolina?
Margarita.
No,
Margarita.
they're here, the first one. Can you repeat the first set of names you said?
Miguelina and Benito.
Please state your name and begin your testimony.
Diga su nombre y comience tu testimonio.
Buenas tardes o buenos días. Mi nombre es Miguelina Espinal.
Good afternoon, my name is Miguelina Espinal. You have to make any pauses.
Mi tienda está ubicada en la 901 South 58th Street,
My store is located at 901 South
58th Street,
58th Street,
lo que es Cass Creek.
Cascade.
Cass Creek.
Cobb Creek.
Sí,
Cobb
Cass
Creek.
Creek.
Neighborhood.
19143.
It's 19143.
Tengo más de 10 años en Cass Creek y he trabajado en mi tienda con la comunidad.
I have more than 10 years working at Cobb Creek community, and
Yes, speak into the microphone.
this one is, okay, it's on already. Thank you. I've been in the community for 10 years working with the Cobb Creeks.
He trabajado y tengo mi licencia de tabaco gracias a que a todos los clientes le pregunto por el ID.
I have been working in my store for that long, and I have my license. Thank you that I ask everyone for an ID.
He tenido un inconveniente de 5 años, 6 años atrás.
I have been having a situation from 5 or 6 years ago.
Después que aplicaron la ley en el 2016, la ciudad cambió.
After they applied the law in 2016, city changed.
Se incrementó el negocio clandestino, venta de tabaco en tiendas ilegales sin
So,
licencia.
The business of selling counterfeit tobacco products increment in the city.
Estas tiendas irregulares no preguntan por ID a los niños.
Those irregular stores, they don't ask for ID to the children.
Están ubicadas en mi vecindario porque es un vecindario pobre.
They are located in my neighborhood because we are a low-income neighborhood.
E incluso frente a escuela hay tiendas 24 horas abiertas y no preguntan por ID. Es venta pública, es a todo el mundo.
Even in front of school, they are a store that open 24 hours, and they are selling to everyone. They don't care.
Me preocupa porque tengo hijos y porque sé que no es posible que si yo estoy regulada, pago mi impuesto y tengo inspección, quiero que lo traten igual, que la ciudad nos trate igual. A nosotros los que estamos regulados con licencia y a las tiendas clandestinas que no tienen licencia. Quisiera que sean tratados con la misma inspección, dónde compras el tabaco, a qué wholesale tú vas.
I'm worried about it. I'm worried about the situation. I am a mother. I have children, and I would like for the city to regulate those stores as they regulate us. I pay taxes. I have all my licenses, and I do all I have to do. But they are over there. They are every corner is one of them. Continúa.
Entiendo que la ciudad ha dejado de ganar dinero y nosotros como comerciantes hemos perdido dinero también.
I understand that the city has made or earned less money, but we also have.
Las tiendas clandestinas que ustedes están supuestos a supervisar venden tabaco en la noche, venden tabaco en la madrugada. Los niños no tienen hora para comprar tabaco. Nosotros somos responsables a no vender tabaco a niños, pero aquí hay un descontrol.
So those stores are not regulated. They have no inspections, and they operate overnight. And the youth, the children can go to those stores anytime. We are regulated. We do what the city asks us to do, and we pay our taxes.
Quisiera, por favor, pedirle que tengan una mejor inspección en las bodegas chinas, en las africanas, en las convenio stores, en las Dominican Grocery, que todos estemos tratados con la misma igualdad de inspección y de exigencia.
So I would like for the city to inspect those stores, like the African, the other nations, also Dominicans, or the convenience store, that they don't have the adequate license. So just inspect them, and if they have the regular license, it's okay.
Le hago el comentario porque mis clientes me reclaman que por qué nosotros pidamos ID, donde otras tiendas no piden ID.
So I make this comment because my clientele, they are asking me, why are you asking for ID if the other store are not asking for ID?
All right, well, listen, thank you very much. We have a time limit, but I hear you. That's why we asked the health department, how many unlicensed stores are there? We are going to look at that. As you know, we have not enough police and not enough LNI, license and inspection, people to go and look at all these criminal activities, and the health department doesn't have enough resources who are supposed to go monitor. But we hear you that you're doing the right thing, you guard and you make sure your business is doing the right thing, and we hear you. But there are businesses who are got their license who are not doing the right thing. So that's why we want to make sure everybody is doing the right thing, and we have to go after those who are completely unlicensed, the shops, smoke shops that pop up. We
Gracias.
are aware of that problem.
Gracias por su testimonio. Estamos conscientes de que ese tipo de negocio está proliferando ahora mismo, pero le agradezco a usted porque usted está haciendo lo correcto, usted está pidiendo identificación. Tenemos aquí presentes el Departamento de Salud. Queremos trabajar en comunicación con ellos para que podamos en conjunto identificar esos negocios que no tienen licencias. También el Departamento de Salud y License Inspections, por sus siglas en inglés, LAI, no tienen suficiente personal para atender todas las demandas que hay. Pero vamos a trabajar en eso y muchas gracias por su testimonio.
Gracias.
Thank you.
Gracias. Would you call the next, the clerk would call the next witness?
Margarita Collado. No.
Next.
Leo Sanchez.
Un minuto tiene.
Un minuto, ok.
Please state your name and begin your testimonies.
Mi nombre es Leonardo Sánchez.
My name is Leonardo Sánchez.
Siempre he trabajado esto. Tengo 24 años donde estoy instalado. Tuve 23 años con licencia de vender cigarrillos.
I have been working this for 24 years, and during 23 years of those, I had license.
Me llegaron 2 tickets. Hablé con mi contable, me dijo, págalo. Lo pagamos. Cuando fui a renovar, me mandaron la licencia de vender cigarrillos, pero no el permiso de vender tabaco.
So I received those 2 fines. I talked to my accounting person, and he said, pay them. When I did pay them, and then I received my license back, but not my permit.
Continue.
Ok, siempre he tratado de nunca venderle a los menores. Si tuve todo ese tiempo con licencia, me mandaban muchos papelitos felicitándome. Ya eso ya no existe. Me llegó también una inspectora a la hora de cerrar.
I have always followed the rules. I have always asked for an ID. I had 23 years having a license. But then one day an inspector showed up, late afternoon.
Ok, me llegó una inspectora a las 7 de la noche a la hora de cerrar y me dijo que yo le había vendido a un menor y yo le dije, búscame pruebas, te busco la cámara. Y me dijo, a mí no importa, toma tu ticket y se fue por ahí mismo. Ni lo llenó bien.
So the inspector came at 7 p.m. and she said, you sold cigarettes to a minor. And I asked her, okay, when? And when I did it, I can show you the camera. And she said, no, you have your summons. Here's your ticket, and left.
Fue un cliente que fue a la gasolinera y fue a comprar algo, pero lo tenía en la mano y ella dijo que fui yo que se lo pasé. Yo estoy seguro que no.
That customer bought something at the gas station. She saw that he has that product in his hand, and she said that I sold it to him.
Eso es todo.
Thank you. Well, thank you. So, again, like that other person who was found to be not having sold but was ticketed, I would like to get your information so we can follow up with the health department to see how the investigation was done, because they're supposed to, once before issuing the ticket, they're supposed to verify that that's, and I want to understand that process, so we'd like to make sure I think we have your information, we'll follow up with you on that, and with the health department.
Creo que tenemos su información y el otro señor también queremos su información para darle seguimiento porque tuvo que haber una investigación con ese caso, pero le vamos a dar seguimiento y gracias.
Gracias.
Gracias. If you would call the next witness, please.
Rofin Rodriguez and Renny Mesquita.
If the council
Please state your name and begin your testimony.
Buenas tardes, mi nombre es Rolfin Rodríguez, soy dueño de RJ Mini Market Inc.
My name is Rofin Rodriguez. I am the owner of RYJ Mini Market. If the interpreter can ask the counselor the panel to read, I can read the statement that they have it, so it'll be easier and shorter.
That would be fine, thank you.
Entonces, le pedí permiso para leer la declaración del señor Rolfin, que sería más fácil y más breve. Usted la tiene ahí, el señor la tiene escrita en español, pero ustedes no necesitan la traducción. Creo. I want to express my disagreement with the new legislation, as I believe the city is imposing overly drastic measures on a small business. As the owner of a business that served our community, I witnessed firsthand the challenge we face daily, especially after the pandemic. We have not yet fully recovered from the financial losses we suffered during that time, and now we are facing new regulations that threaten our financial stability. I understand and support the importance of preventing the sale of tobacco to minors, as it is a crime that should be penalized. However, fines being imposed excessive and do not take into account the economic reality of small business owners. Currently, the minimum fine is $250, already present a heavy burden on businesses like mine, which operate on very light profit margins. If these penalties increase or become stricter, many small businesses will not be able to stay open. Bodegas and small business play the fundamental role in our communities. We don't just sell products. We provide an essential service to those who, for various reasons, cannot travel to large supermarkets. Many of our customers are already elderly people, low-income families, or workers who rely on the proximity and accessibility of our establishments. If the authorities continue imposing regulations without consideration their impacts on a small business, we will be forced to close our doors, affecting both business and owners and the communities as a whole. We ask these penalties to be reconsidered and that more equality solutions are explored, such as educational programs for owner business, warning before using fines, and penalties that are proportional to the severity of the violation. Small businesses are the backbone of many communities, and we need to support the authorities to continue operating. We are not asking for this regulation to be removed, but rather for them to be implemented as they are reasonable way, without engaging the livelihood of hundreds of hardworking business owners who dedicate themselves daily to serving the neighborhoods. We appreciate that our concerns are being heard and hope that measures will be taken as long as to move forward without harming the economy of those who, with the effort and dedication, keep our business alive.
Well, thank you very much for your testimony. I hear you. We want our small businesses to thrive. All we are asking, just like my colleague, Councilmember Cindy Bass said, card everybody. No fine if you don't sell to minors.
Queremos que todos los negocios brillen y sobrevivan. Lo único que le estamos pidiendo aquí es que pidan identificación, no tarjeta 90. Can I ask you a question?
A veces nosotros, los pequeños negocios, no tratamos, cumplimos las leyes, pero a veces van los mayores de edad y le compran tabaco a los menores y se le entregan fuera del negocio o se le entregan quizás a una esquina después.
So I just want to clarify, we do follow the rules, but I'm asking, la pregunta es, ¿qué pasa con ellos? Porque esto no terminó.
Sí, que nosotros, van personas con su identificación que sí le podemos vender tabaco. Entonces, esa persona lo que le están comprando tabaco es a menores y se lo entregan fuera de la tienda o quizás a una esquina después.
So what happened with an adult that purchased cigarettes for a minor? They can purchase for them in the store, but they go outside and give it to them, maybe a block later or outside.
Yeah, that's, you should not be ticketed for that. If an adult does that, that's an adult problem. That's their problem, not yours.
Entonces,
Totally understand, yeah.
Ese es el problema de ese adulto, no de usted. Usted no hizo nada ilegal.
Yeah.
Está bien, gracias.
Thank you.
Absolutely. Thank you for your testimony. We have our last witness.
El último testigo se presente.
Actually, we have two.
Two, sorry.
Hay dos más.
Renny Mesquita.
Mesquita. Diga su nombre primero.
Please state your name and begin your testimony.
Mi nombre es Renny Mesquita.
My name is Renny Mesquita, owner of Benner Street Food Market, Inc. And I am proud to be a bodega owner. I want to express my strong disagreement with the new legislation, as I believe the city of Philadelphia is unfairly targeting small business owners like us. Lately, all we have received are fines and contact inspections from officials who do not recognize the hard work we put in every day. Bodegas are essential business for our community. We open our doors more than 14 hours a day, providing essential products, services to our neighborhood. We pay taxes, create jobs, and most importantly, we have established our business in areas where no one else was willing to invest due to the high crime rates. Thanks to our presence and commitment, many of those areas are now safer. Bodegas are the heart of our neighborhood. Every morning, our community gathers in our store for coffee, breakfast, or to prepare their children before they go to school. We don't just sell products. We contribute to the well-being of our neighborhood and strengthen our community life. As a small business owner, we demand to be treated fairly with respect. We do not ask gain regulations, but we need them to be fair and acknowledge that the vital role we play in the city. We urge the authority to recognize our hard work and reconsider these measures that only harm us instead of supporting us.
Thank you for your testimony.
Gracias
And
por
I'll
su
just say it again, that this is, and I told one of your colleagues, that this is like the red light camera on Roosevelt Boulevard. It makes you slow down. This fine is to make you think and make sure you card everybody. If there are issues that you didn't sell to minors, those are things we must pay attention to and improve the process. But this increase is for helping protect our children. When they ingest, inhale the vaping product, it hurts their lungs forever. We can't fix it. So I want all of us in our community to take responsibility and say we will make sure we are not selling to minors. That's all. You don't sell to minors, no fine.
Entonces, muchas gracias por tu testimonio. Como le dije a sus otros colegas, lo que estamos aquí es, queremos trabajar en comunidad, que estén estén pendientes como la luz roja que está en el Roosevelt Boulevard. Usted ve la luz roja, usted disminuye la velocidad. Entonces eso es lo que queremos, parar el uso de los cigarrillos a nuestros jóvenes. El daño que se le hace a un pulmón, a los pulmones, es irreversible.
Una pregunta.
A question.
Yes, go ahead.
Yo estoy de acuerdo con lo que pongan con la multa, pero que nos consideren.
I agree with the fine, but take us in consideration.
I hear you. I hear
Escucho,
you.
escucho.
And we've already have an amendment to reduce it, so it's not 5,000.
Entonces sí, ya sometimos una petición para reducirlo, no son $5,000.
Gracias.
Gracias.
Thank you.
Call up the last witness, please. Julie? Where did Julian go? Oh. Okay. No, we can just, she's here.
Okay.
Please state your name and begin your testimony.
Diga su nombre y comienza tu testimonio.
Hi, good afternoon. My name is Delfina Arias. I want to express my strong disagreement with the new legislation, as I believe that the City of Philadelphia is unfairly targeting bodegas while turning a blind eye to the largest business that commit similar violations. And when I said that, I'm talking about like big establishment like supermarkets, because the bill that you guys passed, I think it was in 2015 or 16, they take the license away from a lot of us, like especially the new owners, not just the old ones. Like when you buy a business, you're not allowed to have a cigarette license, but we're still paying for the state license. So there's no way that we being teach, because we didn't receive any letter or anything to each store saying that you're not allowed to use the state license while you don't have the city license. And I bring that point because I work with my father, and as a grocery store owner, the city was like 4 years, they didn't go to inspect the store, but the state usually go every year. So the first years they go, they saw cigarettes, and they put a fine to my dad for the cigarettes. But they never told us to remove the wraps, which is included in tobacco retail license. And the city came this year, and they closed us down 48 hours because we have a ticket from 2021, what I think was unfair. Because if you don't have the amount of people to do the job, what they're supposed to do, we don't have to pay for that. And especially, they do random inspections, like going during hours, that is when we are crowd. Like, how you expect a fridge to be in the right temperature when you go 11:30 or 12 or 1 o'clock in the morning when it's the rush hour? No fridge is gonna have the exact temperature. So she marked that down in the report. And normally that's all what they do. Like, they go in the hours and they check the temperatures, whereas it doesn't make any sense to me.
So you're talking about other issues, not about selling to minors.
Yeah,
I hear you that there's some other things we need to address, but right now I'm just trying to focus on making sure our retail establishments card everybody and not sell tobacco products to minor. But I hear you about the other things you mentioned, and we are happy to follow up with you to make sure that you're being treated fairly. We can have a conversation with the health department with you about the other issues. But I'm just wanting to make sure everybody here understands. I am talking about a bill that will say it will be the fine if you sell to minors. There's a first, second, and third time. We're giving 3 chances for people to not do this. And I am asking all of you to participate with us to protect our children. That's
Yeah,
all
we
this
do.
is about. This
And
is all
I
this
agree-
is about.
and I agree with that.
I appreciate that, you understand that, and that is what this is about. And If you have other issues, please get in touch with my office. We are happy to follow up on these other things you mentioned. Sometimes, this is why we're having a hearing. When you have when you put out some rules, sometimes the rules look fine for us, but not for people who will feel it, right? That's why we're doing this, to hear from you, and that's why I'm going to recess this meeting, meet with all of you and the health department, and then vote on this. So I'm listening to you.
Yeah, and my question is because
Councilmember Bass, yeah.
yes, when she asked the Department of Health that he says that the numbers change, she said no, there's no change. So why having a law stopping us for getting a license? And we're doing the right things. I don't say everybody, probably any other infract the law.
Yeah.
But my question is, you was mentioned the red light. You put in that as an example. But I think since 2025, the fine for a red light is $100. So since they don't increase in the fine so high extremely, they probably put like $100 more if they're gonna increase it. And you don't see a person that trespass the red light going to do, they don't make it go to do community service like in a hospital, seeing what can cost when you pass a red light.
Right. So the red light analogy is about slowing people down, right? Having red lights has proven that it slows people down. And that's what we're trying to do with this bill, is slow people down to do the right thing. And in a red light situation, if you kill someone, it's a lot of problem, right? And then same thing with here. You're slowly killing children because their lungs are at risk. So we do not want our children to be exposed to this, and that's why we need to work together to stop it. If people follow the law, there's no fine. No one is going to do any fines, and if there's some problems with it, we're happy to look into it if somebody is, unfairly been targeted. All of those we are happy to address, but the issue is that we need a deterrent for people who are selling products to minors to stop it. That's all. That's all this is. So I thank you for your testimony, and we're going to convene again with all of you so we can have more conversation. Okay?
Yeah, one more thing. And we have the reunion with the Department of Tobacco, and she practically didn't have any answer for us because she says she was taking notes. And like you said, that's the best idea to have a reunion with you guys and with the Department of Health. Yeah, because there's a lot of misinformation because you guys said one thing, they said another thing, and you guys don't get each other together on that.
Yeah.
And we paying the price because I don't agree with the fine. I'm okay with the one that is right now, but I don't agree with the fine because if all my colleagues giving complaints with the tickets, that sometimes they get it in the wrong time. Like when people go and buy tobacco before, they used to give them the fine right there in the exact moment. Like they say she came and she sent a minor. So the inspector come right after them and give you the ticket. So I don't know why they don't still do it in the same way and they wait like 3 months. So it's no way.
We will look into that. I heard that very clearly from everybody that that's a problem.
My point is that if they doing a lot of irregularities with these tickets, imagine if you increase the fine to 1,000, 2,000, what's gonna happen to us? We're gonna pay the price and the tobacco company won't gonna pay at all?
Yeah, so we'll make sure that it is done fairly, it is done equitably, and we are going to make sure that that happens, and that's why we're going to have this meeting before we move on things. All right? So we heard you. Thank you very much. Gracias. Is this the clerk call any more further witnesses?
There are no more further speakers on the list.
Okay, thank you. So I would like to thank all of our witnesses for joining us today. Very important information was shared, and that is going to determine our path forward. We will now recess this meeting and we will not vote on this bill to pass it out of committee as of yet, but we will reconvene at another point after I have had a chance to meet with all of you, hear more from you, and talk to the health department to move forward. So I want to now go into recess, and thank you all again, and thank you, my colleagues, for sitting through and hearing all this important testimony.
Thank you.